Hi, Dr. Hagmeyer here, and if you watch today's video, you're going to learn just a ton of information that most doctors will never tell you when it comes to your thyroid disease. I just finished up a video titled Reversing Thyroid Disease Naturally, where I talked about the 10 steps that you need to take in order to naturally support your thyroid gland. And one of the most important components that I wanted to dig into a little bit and just unpack for you a little bit more, because I ran out of time in the last video, was the concern that I have that relates to vitamin deficiencies and mineral deficiencies that we often see in people with thyroid disease and autoimmune thyroid problems. So that's kind of what we're going to unpack today. So we're going to talk about the 5 most common deficiencies that are associated with thyroid disease and Hashimoto's. Now again, this is a big problem for people with thyroid disease for 5 main reasons. Number 1 is our diets lack green vegetables. It's simple, right? Most people just simply don't eat enough green foods. We don't eat enough good, clean proteins and fats. And remember, proteins and fats literally become the building blocks of neurotransmitters and hormones and many other tissues of our body that need to be repaired. Now, our diets are also filled with grains and now gluten-free substitutes, right? These block the uptake of many of these nutrients. And finally, most people with thyroid disease have compromised digestive function. So even if you are eating a good diet, you're eating clean, you're perhaps not breaking down and absorbing those nutrients into those fat-soluble vitamins, into the proteins and the amino acids and the minerals, and basically all of those things that are needed for optimal thyroid health. Now, regardless of your diagnosis, whether you have hypothyroidism, Graves' disease, Hashimoto's disease, the information that I'm talking about across the board is still relevant. And I'll tell you, in the 17 years that I've been in practice, these deficiencies, they just continue to be a problem for millions of people around the world that I'm so lucky to work with, okay? So the first vitamin deficiency that we often see is vitamin D, all right? Now you might be tired of hearing about this one, all right? But it's critical to your health in just so many ways. Now everybody's heard about the importance of vitamin D for bone health, but what if I told you that vitamin D has been shown to be one of the most important vitamins when it comes to the health of your immune system? You should have alarm bells should be going off right now if you have either Hashimoto's or Graves' disease. Why? Well, because these are autoimmune diseases. Now, the key here is trying to uncover why you're vitamin D deficient. You see, vitamin D deficiency could be caused because you work indoors every day and you never see the light of day. Vitamin deficiency could be caused by problems related to the GI tract. Maybe you have a leaky gut, or you have gluten sensitivity. You have small intestinal bacterial overgrowth, or a lack of digestive enzymes that are causing you not to be able to absorb and break down this fat-soluble vitamin. That's what vitamin D is, okay? All of these scenarios and many others could be the cause of your low vitamin D. Now, when I see a patient with low vitamin D, my first thought is not, oh, this person needs vitamin D, okay? Which of course we give them, but more importantly, the question that we need to ask ourselves is, what is the mechanism? Why does this person have low vitamin D in the first place, okay? Because chances are, if they're low in vitamin D, they're probably also low in some other fat-soluble vitamins like A, K, and E. Remember, your fat-soluble vitamins are A, D, E, and K. So again, when it comes to thyroid disease and autoimmune disorders, it's a big puzzle, and you need to be able to get clues, and the more clues you have, the more of this puzzle you're going to be able to put together, okay? So as you can see here, well, I should say, as you see here coming up on the screen, there are several studies that I've listed here that show the importance of vitamin D and its connection to autoimmunity and diseases like irritable bowel syndrome and inflammatory bowel disease. Okay, so it's very important, vitamin D. Next is our second vitamin that you want to be aware of, and this relates to thyroid disease, is vitamin A. Okay, now vitamin A has many important roles in the body. It's, again, another fat-soluble vitamin. It's important for hair and skin and nails, night vision, and again, the immune system. All of these tissues of our body depend on vitamin A. So you might be saying, well, what's the connection that vitamin A has with the thyroid? Well, here it is. Many women who suffer with thyroid disease also suffer from symptoms such as hair loss, loss of skin tone, brittle hair, nails, accelerated aging. And part of this lies in the problem that people who suffer with thyroid disease can't convert beta carotene into vitamin A. Very important. Now here's just one study that I'll pull up here showing how serum TSH concentrations or TSH levels in the blood can be reduced with patients who were treated with vitamin A. Very important for those patients with thyroid problems. The conclusion of the study was that vitamin A supplementation can reduce the risk of subclinical hypothyroidism in premenopausal women. So like I mentioned earlier, vitamin A is a fat-soluble vitamin, like vitamin D, and so if there are GI issues that affect the absorption, then low vitamin A can only contribute to low thyroid, but also not getting converted into vitamin A from beta-carotene. So here's why the gut's so important, all right? Number 3 is selenium. You probably heard about this one too, but one of the most common problems seen in women with low thyroid disease is a problem known as low T3 syndrome, or thyroid underconversion. Now this happens when the body doesn't convert T4 into T3. Now you'll remember that T4 is the inactive form of your thyroid hormone, and it has to get converted into the active component, the hormone that does all the magic in your body, known as T3. So for many women, T4 levels are normal, but T3 levels, if you test them, they would show up being low. So you might say, well, what is the connection here between selenium and thyroid? Well, here again, not only does selenium assist in the conversion of T4 into T3, but it's also essential for optimal health of the immune system, okay? Research studies have shown that taking selenium can lower inflammation and stress on the immune system. And again, that should be important because when you consider that Hashimoto's and thyroid problems, by their very nature, are autoimmune in most cases, it becomes important to see what we can do and what action steps we can take to mitigate the damage on the immune system, or that the immune system is doing to the thyroid. This study showed that 70 women that had either elevated levels of thyroid peroxidase, or TPO antibodies, or they had elevated thyroglobulin antibodies. So they either had elevated TPO antibodies or they had elevated TGB antibodies. 36 patients were given 200 mcgs of selenium a day. The other 34 were given a placebo. And what they found was a significant drop in TPO antibodies in the group that received selenium, and none those that received the placebo. So the study ends by saying that we conclude that selenium substitution may improve, that's a key, may improve inflammatory activity in patients with autoimmune thyroiditis, especially those with high activity, okay? So we can see here, overall, we know that fat-soluble vitamins are important. We know that vitamin D is important. We know that selenium is important. The next is iron, okay? Now I have several videos that I've done on the importance of iron, where they should be, what your levels should be, what markers you should look for on blood work. So I don't want to spend too much time on the importance of iron here. But study after study just continues to show that in order to make thyroid hormone, you need to have proper levels of iron. So if you are iron deficient, this iron deficiency will impair the way your thyroid hormone, or will impair the way your thyroid actually makes thyroid hormone, and also impairs thyroid peroxidase. So again, thyroid peroxidase, again, we just talked about this, but it's one of the enzymes that is often attacked in Hashimoto's disease, okay? This is the TPO antibody that we've been talking about in so many different videos, okay? Thyroid peroxidase is stimulated by TSH, and once it's stimulated, it takes iodide and it converts it into iodine, okay? Now when we talk about T3, we're really saying that T is the tyrosine, which is an amino acid, and that tyrosine, or that amino acid molecule, has 3 iodine molecules attached to it. And when we say T4, again, we're saying tyrosine has 4 molecules of iodine attached to it. So you might be wondering, you might be thinking, well, how does iron deficiency develop? Well, a couple ways. With iron, it can be due to poor dietary intake. We're not eating enough red meat. Maybe we've had a vegan lifestyle. We were a vegetarian, okay? It could be a fact that we're just not simply eating enough green leafy vegetables, all right? Other factors that can predispose a woman or a man, we'll talk about a woman here just for this matter, but you know, iron deficiency in women can be caused by low stomach acid, either because perhaps a woman has a heavy menstrual cycle, okay? Maybe there's PCOS. So again, there's a lot of different reasons that a woman might be iron deficient. Iron anemia could come from an inflammatory bowel disease like Crohn's disease or ulcerative colitis, okay? It could come from an infection. It could stem from, specifically if we're talking about the gut, it could be coming from something like small intestinal bacterial overgrowth. It could be originating from something known as celiac disease, okay? Because these are disorders of the gut that compromise absorption. And if we compromise absorption, it's going to lead to nutritional deficiencies. So just because your blood work shows that you are iron anemic, the question we still need to ask ourselves really is again, why are we anemic? So while taking iron, taking iron supplements can raise the levels and the serum levels of iron, it still doesn't fix the underlying cause of the anemia if we have H. pylori infection or heavy periods or endometriosis or some other problem. It can't correct the problem any more than taking vitamin D or vitamin A corrects the vitamin deficiency if we have a gut problem. So again, we need to think about big picture. We need to ask ourselves, why do we have this deficiency in the first place? Okay? So the next on the list is vitamin B12. Okay, now B12 is a vitamin which really just has a key critical role in the nerve system. It plays a key role in red blood cell metabolism, gives you energy, helps you focus. A lot of people take vitamin B12 for the purpose of improving focus and concentration. Some people take it to improve mood, but it's often referred to as your stress buster hormone. Okay. B12 is also needed in our methylation pathways, okay, which you've probably been hearing a lot about lately with its connection to thyroid disease, okay? I've done a video series that talked specifically about thyroid disease and the MTHFR mutation. This is huge, but some studies show that as much as 60% of thyroid patients have a B12 deficiency, okay? Vitamin B12 is also needed to make SAMe, okay, and SAMe is important because it plays a role in glutathione production. And this is incredibly important if you have an autoimmune thyroid problem, or again, any other autoimmune disease for that matter. B12 is needed to help break down homocysteine, again, this is an inflammatory marker that's associated with increased risk of strokes and heart disease. So the list goes on in terms of why B12 is so important. Now, there are many causes behind B12 deficiency and why people will why people with thyroid disease often have this deficiency in the first place. So let's kind of talk a little bit about those. Number one is years of digestive issues, okay? And this is obviously very, very common with people that have thyroid problems, but years of digestive issues, such as low stomach acid, again, or infections with H. pylori will be a common culprit. When people have an autoimmune disease, it's not uncommon that their immune system begins attacking other tissues and other proteins of the body, and one such blood disorder is associated with Hashimoto's is called pernicious anemia. Now, in pernicious anemia, the immune system begins to attack the protein that's needed for B12 absorption. And this is why you potentially could have, again, low B12 levels. Okay? And also, if you have Hashimoto's, it also makes sense to have your doctor that you're working with test you for this as well. Okay? Very important. Now, there are a lot of other causes for B12 deficiency, and these include things like medications. Very often proton pump inhibitors, okay, can cause B12 deficiency. And by the way, these are the same medications that have been shown to increase hip and spinal fractures. So that brings us to the final and probably the most controversial mineral deficiency when it comes to thyroid disease, and that's obviously iodine. Now, I've dedicated numerous videos, blog posts, articles on this mineral, so I'm not going to get too much into it, but there are some things I want to share with you, okay? Number one is what you'll find is that some sources claim that most people are iodine deficient. You'll find other sources that suggest that most people have sufficient levels of iodine. So let me say that while iodine is very important for the formation of thyroid hormone, and iodine has been shown to help women with fibrocystic breasts, if we're strictly talking about iodine and its relationship to thyroid disease, we have to realize that the number one cause of low thyroid disease is not a deficiency of iodine, but rather Hashimoto's autoimmune disease. So the reason that a person that has Hashimoto's should avoid iodine is because study after study after study shows that iodine intake can increase your TPO antibodies. And so it's for this reason that I don't advise anybody that has Hashimoto's to use iodine. Now you might be thinking, well, what about testing for iodine? There's a lot of different other vitamins that we can test for. We can test for vitamin D, we can test for a lot of other different vitamins. Can't we just test for iodine deficiency? And if we need to, just simply take it. Well, unfortunately, herein lies the problem. There really is no good way of testing iodine. Okay? Some sources say that you can test iodine status with an iodine patch. Okay? Others say we can test iodine using blood in terms of furrowing out deficiencies of iodine. Other sources say that urine is the best way. Unfortunately, researchers can't really seem to agree if any of these ways are accurate to measure iodine stores, okay? So if you ask me about iodine, I always prefer to err on the side of caution. Many of the patients that I work with are autoimmune, okay? And so this is one thing that I'm constantly being on a vigilant aspect of making sure that my patients aren't taking iodine, okay? Now, I will say that over the years, I've had too many patients who have come to my office only after they've ignited this autoimmune response because they've done an iodine patch or they've done iodine loading or they've taken iodine in thyroid supplements because they read on the internet taking iodine will help you, okay? So I think if you're going to take iodine, you really need to make sure that you rule out Hashimoto's, not once, but several times, okay? So in other words, I wouldn't hang my hat on the fact that if your antibodies come back negative, or they come back normal, or they come back within range, that you're not autoimmune, okay? Here's an interesting study. Studies show that anywhere between 10 to 15% of the population, for many different reasons, can have normal antibody response and still have Hashimoto's. Other studies point to the fact that they could be in a more silent or an earlier stage of autoimmune thyroid Hashimoto's, and so you don't have the immune system's response to those antibodies yet, okay? There are also factors like medications, like corticosteroids, that can suppress antibody production and make antibody levels appear normal. So as you can see here, there are many reasons as to why a normal antibody response shouldn't just be taken lightly. Okay, you still have to be vigilant about whether or not there's an underlying autoimmune issue, okay? But again, this would be a whole nother video where we have to start talking about the different parts of the immune system, the Th1, the Th2 immune system responses, and perhaps that might be a topic for a later video. So there you have, we talked about the 5 most common nutritional deficiencies, why they can happen, but most importantly, what I hope I impressed on you was not that you need to rush out and start taking all these different supplements, but rather stop for a moment and really ask yourself, what's causing the deficiencies in the first place, okay? And this is how a doctor who practices holistic medicine and functional medicine begins to think, okay? We need to really start understanding the mechanism that's behind this deficiency and then correct that cause, okay? Anybody can take vitamin D because their blood work shows low vitamin D levels, but what we really need to do is take a step back and ask why the deficiency exists, okay? Remember, these deficiencies can be caused by medications. They can be caused by where you live. They can be caused by toxicity or toxic body burden level. They can be affected by the foods you eat or the foods you don't eat. They can be affected by how well you absorb and break down the foods you're eating. And of course, they can be affected by existing metabolic problems. So the key here is work with a doctor, work with a holistic and functional medicine physician who really is going to be able to look at your diet, is going to look at the big picture, not just someone who loads you up on a bunch of different vitamins and tells you to have a good day, all right? Well, that covers this video. I hope you enjoyed it. If you like it, please make sure that you subscribe to our channel. Check out our website. There are thousands of pages on our website that have additional videos and articles and recipes and so much more for you to read. We do work with patients around the world, and so if you have questions about that, simply drop us a line. Visit our website, fill out a contact us form. Someone will email you or some way get a hold of you, and we can then set up some time and figure out how we can best help you, okay? Remember this, take care of your body, okay? You only have one, and it really needs to just last your lifetime, so take good care of it. It's a treasure. Take care.